Welcome. My name is John Del Valle. I'm professor of internal medicine, vice chair, and program director for the Internal Medicine Residency Training Program. I'm delighted that you're showing interest in visiting our program today. A little bit about myself. I came here quite a bit ago, 1983, to do my fellowship, and the original plan was to spend no more than 3 years. And a lot of time has passed, and here I am. And that may be exemplary of why people come to Michigan and what eventually keeps them here. When looking at a program, I think it's important to understand, what are your goals? What do you hope to achieve? Our goals for your training in Michigan is really to reach maximum potential, whatever that is, whatever you envision for yourself. Achieving excellence as a clinician, as an educator, as a scholar is paramount. Critically important to integrate into the community around us and afar, and eventually becoming leaders in your field, whether you're a primary care physician at your local community or part of an academic environment. Ultimately, we want to move away from surviving, which is what residency once was, but instead thrive. Thrive while really embracing meaning and balance. Our approach to your education and training is, I believe, straightforward, and it encompasses a series of aspects. First and foremost, it's the experiential piece, the encounter with patients, working with your patients. That patient experience is vital. But in the graduate medical education world, as important as the patient experiences are, it's vital to also incorporate education in a very meaningful and formal way. We look towards developing innovation in teaching, and for us, a very important message to leave with today is that the residents play a critical role in all aspects of our training program through their feedback and involvement. You're looking at many wonderful places across the country, I'm sure. So what makes the University of Michigan particularly attractive? First and foremost, if you look at our health system, it's ranked amongst the best in the country. Not only does it excel with patient care, but one of our main missions is research. We have extraordinary investigative resources, not just within the hospital, the medical school, but across our entire campus. Within the Department of Internal Medicine, we have obtained millions upon millions of dollars in research support and are amongst the most productive departments in this institution, as well as across the country. A critical part of our mission in the care of our patients is partnering with our VA in the Ann Arbor Health System. It is an extraordinary institution. It's an honor to care for our veterans. They have sacrificed of themselves so we can do what we do day in and day out, and it's an honor to care for them. Our VA was originally built in 1953, has been completely renovated as recently as 2019. We serve over 76,000 veterans in 19 counties across Michigan and Ohio. We count on over 1 million outpatient visits in 2022 and 2023, and our inpatient care beds have recently expanded to 140. So how do you go through the process of selecting a program with all the data you have? I would pose that you ask several questions. First, what is the overall health of the department? Second, who are the people? And this is probably the most important question. Who are the people that you will be training with? It's important to ask, is the program committed to your education and career development? And very important, does change occur? And if so, how does that occur? In subsequent presentations, you'll see more details as we approach each one of these questions as you search as to whether the University of Michigan Internal Medicine Training Program is the right one for you. Thank you.